The forceps clinked against the metal basin, the sound sharp in the sterile silence of the examination room. Dr. Jennifer Morrison stared at the object in her gloved hand, a jagged piece of metal, no bigger than a thumbnail, dark with oxidized blood and rust. "How long has this been inside you?" Her voice cracked despite years of clinical training. Margaret Calloway's face had gone the color of old paper. Her hands gripped the examination table's edge, knuckles white. 52 years, she whispered. "Since July." The fragment bore markings Jennifer recognized from her father's war stories. M67, Vietnam, a grenade. Jennifer's fingers trembled. She set the forceps down carefully, but her mind was racing. This woman, this patient, had carried shrapnel since the war. The same war that had given her father nightmares until the day he died. The same war that had broken her mother. Who had broken her? "Mrs. Calloway," Jennifer began, then stopped. 3 days earlier. Leave a like and share your thoughts in the comments along with the city you're watching from now. Let's continue with the story. The October morning light filtered through the curtains of Margaret Calloway's small Portland apartment, casting pale rectangles across photographs that lined every available surface. 50 years of memories, carefully framed, carefully avoided. She moved through her morning ritual with the precision of someone who had learned that routine keeps darker thoughts at bay. Coffee first, in Thomas's chipped blue ceramic mug. The one with the faded navy anchor that he'd bought at a yard sale in 1976, claiming it reminded him of better days, though they both knew he'd never served on a ship. She touched the mug's handle the way other widows might touch wedding rings, seeking comfort in something solid, something real. His cardigan still hung on the kitchen chair where he'd left it 3 years ago, the morning before the heart attack. Navy blue, worn at the elbows, smelling faintly of Old Spice, and something indefinable that was just him. She brushed her fingers across the wool. "Morning, Tommy," she whispered to the empty room. The wedding photo watched her from the mantel. 1975, both of them so impossibly young. Thomas in his only suit, she in a simple white dress from J.C. Penney. They were smiling, but if you looked closely at Maggie's eyes, you could see something that didn't quite match the curve of her lips. Something haunted. She'd been limping even then, though no one had asked why. She avoided looking at the other photograph, the one in the silver frame near the back. A little girl with dark curls and Thomas's eyes holding up a crayon drawing of a house with a crooked chimney. Jennifer, age 4, was written on the back in her own handwriting, though she hadn't looked at it in years. The medication bottles on the counter told their own story. Metformin for diabetes, baby aspirin for her heart. The aspirin was new, prescribed 6 months after Thomas died. For prevention, the doctor had said, though Maggie wasn't sure what she was preventing anymore. Living too long, maybe. She sat down to put on her shoes and noticed, not for the first time, that her left foot had swollen. 3 weeks now. What had started as general puffiness had concentrated into something more specific, a lump on the top of her foot, soft but firm, growing larger each day. She'd ignored it at first, the way she ignored most things about her body that protested its years of use and abuse. But today, she couldn't get her regular shoe on. Mrs. Chen from next door had noticed her limping yesterday. "You nurses," the older woman had scolded in her forthright way, "always the worst patients. You take care of everyone but yourselves." Maggie had smiled and deflected, but Mrs. Chen was right. She'd spent 50 years avoiding doctors, avoiding questions, avoiding the truth. The call to Morrison Medical Clinic had been harder than Maggie expected. She dialed 3 times before letting it ring, her finger hovering over the disconnect button with each tone. "Morrison Medical, how can I help you?" "I need to make an appointment for my foot." "Of course. And which doctor would you prefer?" "We have Dr. Morrison and Dr. Chen available this week." Maggie's breath caught. Morrison, the name she'd given Jennifer before the divorce, before everything fell apart, before she'd walked away from the only person who'd ever called her mom. "Dr. Morrison," she heard herself say. There was a pause, the clicking of computer keys. "We have an opening today at 2 o'clock, if that works." Dr. Morrison had a cancellation. Fate, or coincidence. Maggie had stopped believing in either years ago, but here it was anyway. "I'll take it." Now, at 1:47 p.m., she sat in the waiting room of a clinic she'd driven past 100 times without stopping. The building was older, probably built in the 60s. Brick facade, narrow windows, the kind of structure that had witnessed decades of small-town medical dramas without judging any of them. Inside, fluorescent lights hummed overhead. The waiting room smelled of antiseptic and old carpet. Outdated magazines, People, Good Housekeeping, National Geographic, fanned across a coffee table that had seen better decades. Other patients waited with her, an elderly veteran with a walker, his cap bearing the words Korea 1952, and a young mother bouncing a fussy toddler on her knee. Louis Armstrong's What a Wonderful World played softly from hidden speakers, and Maggie had to close her eyes against the sudden memory it triggered. Thomas had loved that song, had played it every Sunday morning while making pancakes, swaying in the kitchen with a spatula in his hand, trying to coax her into dancing with him. She'd always said no. The magazine in her hands, some article about fall fashion, might as well have been blank. Her eyes scanned the words without comprehension. Instead, she found herself studying the wall of service opposite her chair. Photographs of local veterans, young faces in dress uniforms, older faces at reunions and ceremonies. And there, third row from the bottom, she found him. Thomas, impossibly young, impossibly alive, standing in a group photo dated 1973. His arm was around another soldier, both grinning at the camera with the particular brightness of men who'd survived something they shouldn't have. She'd taken that photo. Her hands, her camera, her moment. Her phone buzzed in her purse. A text from an unknown number. "Mom, I know you're coming today. Jay." Maggie stared at the message. Jennifer hadn't called her mom in 29 years. Not since that afternoon in 1995 when Maggie had packed a single suitcase and walked out the door while her 13-year-old daughter screamed after her. The memory could still knock the air from her lungs. She didn't reply to the text. Her left hand rested on her lap, and the sleeve of her cardigan had ridden up slightly, revealing the small scar on her wrist. Barely visible now, faded to a thin white line, but she knew its shape by heart. A tiny cross, self-inflicted in a moment of desperation in 1973 when the weight of silence had nearly crushed her. She pulled the sleeve down. "Margaret Calloway?" Maggie's head snapped up. A nurse stood in the doorway, clipboard in hand, professional smile in place. Behind her, the hallway stretched back into the clinic's depths, and somewhere down that hallway was Jennifer. Dr. Jennifer Morrison. Her daughter, a stranger. Maggie stood, suddenly aware of her limp, of how much worse it had gotten in just the last week. The veteran with the walker watched her sympathetically, one survivor recognizing another. The walk down the hallway felt longer than it should have. Examination rooms passed on either side, some with closed doors, others standing open to reveal empty tables and equipment. The nurse made small talk about the weather, about how unusually warm October had been, but Maggie barely registered the words. They stopped at room 4. "Dr. Morrison will be right with you," the nurse said, gesturing inside. "Go ahead and have a seat on the exam table. You can leave your shoes on for now." The door closed with a soft click. Maggie sat on the crinkly paper that covered the examination table and waited. The room was small, efficient, sterile. A poster on the wall showed the anatomy of the human foot, every bone and tendon labeled in precise medical terminology. Another poster warned about diabetes complications. Thomas's cardigan was still in her purse, folded small. She'd brought it without quite knowing why, the way other people brought Lucky Charms or prayer beads. The door handle turned. Dr. Jennifer Morrison stepped into the examination room with the practiced efficiency of someone who'd done this thousands of times. White coat crisp, dark hair pulled back in a neat bun, wire-rimmed glasses perched on her nose. 42 years old, and every inch the professional physician. She glanced at the chart in her hand before looking up. When their eyes met, something passed between them that had nothing to do with medicine. Jennifer's hand trembled slightly as she closed the door. Just a tremor, barely visible, but Maggie saw it. She'd always been able to read her daughter's tells. "Mrs. Calloway." Jennifer's voice was carefully neutral, the way people sound when they're working very hard to feel nothing at all. "Dr. Morrison?" Maggie matched her tone. They stood there for a moment, two women who'd once known each other better than anyone in the world, now strangers in a medical examination room. The air between them felt thick with everything they weren't saying. Jennifer moved first, setting down the chart and pulling up the rolling stool. She sat, maintaining professional distance, and picked up her pen. "I see you're here for foot pain. Can you describe the symptoms?" "Clinical. Safe." Maggie could work with that. "Swelling. Started about 3 weeks ago. The whole foot at first, but now it's concentrated here." She gestured to the top of her left foot, where the lump had grown impossible to ignore. Jennifer rolled closer, her movements careful, controlled. "May I examine it?" Maggie nodded. The moment Jennifer's fingers touched her foot, Maggie saw her daughter's jaw tighten. The touch was gentle, professional, but there was something else underneath. Recognition, maybe. Memory. Jennifer's hands moved with practiced skill, palpating the swelling, checking range of motion, but her eyes kept flicking to something else. The scar between Jennifer's index and middle finger. Maggie stared at it, that thin white line she'd seen 1,000 times in her dreams. Jennifer had been 4 years old, playing in Maggie's home office, when she'd grabbed the trauma shears from the medical bag. The cut had been deep, requiring 3 stitches. Maggie had done them herself, sitting on the bathroom floor with Jennifer in her lap, singing "You Are My Sunshine" to distract her daughter from the needle. Thomas had held the flashlight, his hands steady while Maggie's shook. Did Jennifer remember? The way she kept that hand slightly curled suggested she did. "The texture is unusual," Jennifer said, withdrawing her hands. "Soft but encapsulated, non-tender to palpation, approximately 4 centimeters in diameter." She made notes on the chart, her handwriting quick and precise. "Any history of trauma to this area?" "Define trauma." Jennifer's pen stopped moving. She looked up, and for just a second, the professional mask slipped. In her eyes, Maggie saw the 13-year-old girl standing on the porch, watching her mother drive away. "Physical injury, Mrs. Calloway," Jennifer clarified, rebuilding the wall between them. "Have you injured this foot? Broken bones, severe sprains, puncture wounds?" The lie would have been easy. A simple no, and they could continue this careful dance of strangers. But the lump in Maggie's foot throbbed, as if reminding her that some truths don't stay buried forever. There was an incident a long time ago. How long? 1972. Jennifer's eyebrows rose slightly. She glanced at the chart, Maggie's birth date clearly visible, and did the math. You would have been 19. 20. It was November. And you've had this swelling since then? No. The swelling is new. The injury is old. Jennifer set down her pen and folded her hands in her lap, a gesture so reminiscent of Thomas that Maggie's breath caught. Mrs. Calloway, I need you to be specific. What kind of injury are we talking about? The fluorescent lights hummed overhead. Somewhere down the hall a phone rang, the normal sounds of a medical office continuing while Maggie sat on the edge of decisions she'd been avoiding for 52 years. I think there's something in there, she said quietly. Something that shouldn't be. Foreign body? Maggie nodded. Jennifer's expression shifted, curiosity mixed with concern. She turned back to the foot, palpating more carefully now, feeling for edges, for shapes that didn't belong. Her fingers found something that made her pause. I'd like to do an ultrasound, Jennifer said, and possibly aspirate it. Given the size and your description, this could be an organized hematoma or a foreign body granuloma. Either way, it needs to be addressed. Today? If you're comfortable with that, I have time. The question hung between them, weighted with more than medical considerations. Are you comfortable with me touching you? With me opening old wounds? With being in the same room, breathing the same air, pretending we're not who we really are to each other? I trust you, Maggie said, and watched Jennifer's composure crack just slightly. You should read the consent form first. Jennifer's voice was rough. I trust you, Maggie repeated. Jennifer stood abruptly, moving to the supply cabinet. Her back was to Maggie, but her shoulders were rigid. When she turned around with supplies, syringes, local anesthetic, sterile drapes, her face was professionally blank again. I'm going to numb the area first, she said. You'll feel some pressure, but no pain. She didn't ask if Maggie was ready. Maybe she knew that neither of them would ever truly be ready for what was about to happen. The cold spray hit Maggie's skin first, a sharp hiss that made her flinch, not from the temperature but from the sound, too close to something else, something that echoed from decades ago. Helicopter rotors, the mechanical breathing of war. Jennifer noticed. You okay? Fine. Just cold. The needle came next, a pinch of pressure as Jennifer injected the local anesthetic. Her hands were steady now, falling into the familiar rhythm of medical procedure. This she could do. This was safe territory. Just a bit more, Jennifer murmured, working the needle around the perimeter of the swelling. We need to block all the superficial nerves. Maggie watched her daughter's face as she worked, the slight furrow between her eyebrows, the way she bit her lower lip when concentrating. Thomas used to do the same thing when he was fixing something around the house, tongue pressed between his teeth, completely absorbed. You look like him when you do that, Maggie said softly. Jennifer's hand stilled. She didn't look up. We need to wait 5 minutes for the anesthetic to take effect. The professional wall rebuilt. Maggie understood. She'd built enough of them herself. They sat in silence, the clock on the wall marking each second with an audible tick. Jennifer organized her instruments with unnecessary precision. Forceps, scalpel, irrigation syringe, gauze pads arranged just so. Maggie recognized the displacement activity. Keep the hands busy. Keep the mind from wandering into dangerous territory. You were 4 years old, Maggie said, unable to stop herself. Jennifer's hands froze over the instrument tray. When you cut your hand, you were playing with my trauma shears. I'd left my bag open. I know. Jennifer's voice was barely audible. I sang to you while I stitched it. You are my sunshine. I remember. The words hung there, simple and devastating. She remembered. Not just the injury, but the song, the moment, the mother who'd held her and made the pain stop. The mother who would, 9 years later, walk away and let different kinds of pain begin. Jennifer finally looked up, and her eyes were bright with unshed tears. I know who you are. I've known since you called for the appointment. Maggie's throat closed. Then why did you agree to see me? Because I'm a doctor, and you need medical attention. That's the only reason? Silence. Jennifer, we're not doing this now. Jennifer's voice was sharp. She pulled on sterile gloves with quick, practiced movements. Right now, you're my patient. That's all. But it wasn't all, and they both knew it. The air between them crackled with 29 years of unspoken words, unanswered questions, unhealed wounds that had nothing to do with the foot Maggie had come here to treat. Jennifer tested the anesthetic with the tip of a needle. Can you feel this? No. Good. She picked up the scalpel. I'm going to make a small incision. You'll feel pressure but no pain. The blade touched skin, a precise, confident cut. Maggie didn't look away. She'd seen too much blood in her life to be squeamish now. She watched her daughter work, watched the professional competence, the steady hands that had learned to heal in ways Maggie never could. Jennifer applied gentle pressure around the incision, encouraging drainage. Nothing happened at first. She adjusted her angle, pressed again. There's resistance, she murmured, more to herself than to Maggie. There's something structured in here. She repositioned, trying a different approach. Maggie felt the pressure, the probing, but no pain. Just the strange disconnection of watching someone work on a part of your body that feels like it belongs to someone else. Then, a sensation. Not quite a pop, but a giving way, like something that had been held tight, finally releasing. Dark blood began to ooze from the incision, not the bright red of fresh injury, but deep maroon, almost brown, thick, gelatinous, old. Jennifer's eyebrows drew together. This is organized blood, very old blood. She used gauze to absorb it, and the white fabric turned rust-colored immediately. More blood followed, more than should have been there, welling up from some deep reservoir that had been sealed away for decades. How much? Maggie asked. Hard to say yet. 50, 60 milliliters, maybe? Jennifer reached for another stack of gauze. This has been there a long time. As she worked to clear the blood, her forceps hit something, a small, metallic sound, steel on steel. Both women froze. Jennifer's eyes met Maggie's, wide with confusion. Carefully, she explored further with the forceps, feeling the edges of something that didn't belong, something solid, something that had been living inside Maggie's foot for longer than Jennifer had been alive. She withdrew the forceps slowly, bringing with them a small, dark object. In the harsh fluorescent light, it looked alien and ancient. An irregular piece of metal, roughly 2 centimeters long, its edges jagged and cruel. The surface was oxidized, covered in reddish-brown patina, the color of dried blood and rust and time. Jennifer held it up, turning it slowly. On one flat surface, barely visible, were markings, partial numbers, M6. "Mrs. Calloway," Jennifer's voice shook. "Maggie, what is this?" But she already knew. Any doctor who'd treated veterans would recognize it. Any daughter of a man who'd come back from Vietnam would know that particular shape, that size. "Shrapnel," Maggie whispered. "From Vietnam?" A nod. "How?" Jennifer set the forceps down carefully, the metal fragment resting in the kidney basin between them. "How long has this been inside you?" 52 years. Maggie's voice was steady, but her hands were shaking. "Since July." "Since November 1972. The room seemed to tilt. Jennifer gripped the edge of the exam table, her professional composure cracking. "You've had shrapnel in your foot for 52 years, and you never had it removed?" "No." "Why not?" The question was simple. The answer wasn't. Maggie closed her eyes, and suddenly she was there again. 20 years old, standing in the operating room of a field hospital that smelled like blood and disinfectant and fear. The weight of forceps in her hands. Thomas's pale face on the table. The shrapnel in his back that was killing him slowly, while the doctors decided he could wait. The decision she'd made that changed everything. "There was an attack," she said, eyes still closed. "Rocket attack. Things fell. I was helping someone, and when the building shook, I fell. The shrapnel went in then." It was true. It was also a lie. The facts were accurate. The story was incomplete. The art of misdirection she'd learned from Captain Brennan 52 years ago. Jennifer was quiet for a long moment. When Maggie opened her eyes, her daughter was staring at the shrapnel fragment, her face unreadable. "This isn't just embedded foreign material," Jennifer said slowly. "Your body encapsulated it, built a capsule around it. That's why the swelling is organized, why it feels soft but defined." She looked up. "Maggie, this is extraordinary. Medically speaking." "Is it?" "Yes. Most foreign bodies cause chronic infection, rejection. But yours, your immune system isolated it, walled it off. You carried this for 52 years without sepsis, without significant complications." There was something like awe in Jennifer's voice. "Your body protected you." Or punished me, Maggie thought. Every time it ached, every time it hurt to walk, it was a reminder, a penance, a physical manifestation of the lies she'd lived with for half a century. "We need to clean this wound properly," Jennifer said, switching back to clinical mode, perhaps because it was easier than processing what she'd just discovered. "There could be more fragments. There's definitely more organized blood." She worked in silence, irrigating the wound cavity, feeling for additional foreign material. Maggie watched her, this woman who was her daughter, but also a stranger. When had Jennifer decided to become a doctor? Had Maggie influenced that somehow, even in absence? Or had it been Thomas, with his stories of the nurses who'd saved his life? The irony wasn't lost on her. "No more shrapnel," Jennifer announced. "But there's significant scarring inside. Tissue that's been damaged and healed over, probably multiple times." She paused. "You had infections over the years, didn't you?" "Sometimes." "Why didn't you get this treated? Any of it?" "Because I deserved it." The words rose up sharp and true, but Maggie swallowed them back. Jennifer was already looking at her with too much concern, too much confusion. If she admitted that, If she confessed that she'd kept the shrapnel as punishment, as a physical reminder of her sins, what would Jennifer think? It didn't seem important, Maggie said instead. Jennifer removed her gloves, her movement sharp. A piece of metal in your foot for 5 decades didn't seem important? There were other things. What things? What could possibly be more important than your health? You, Maggie wanted to say, keeping the secret that saved your father's life, living with the lie that let us all pretend to be normal. But she couldn't say any of that. Not yet. Maybe not ever. Jennifer stood, paced to the sink, washed her hands with more vigor than necessary. When she turned back, her face was a storm of emotions barely contained. You said you'd explain. After the procedure. Well, we're in the middle of it, and I need to know. I need to understand. Her voice cracked. Her voice. Dad said you left because we weren't enough, that you had depression, PTSD, that you couldn't handle being a wife and mother, but this... She gestured to the shrapnel in the basin. This tells a different story, doesn't it? Maggie's heart hammered. This was the moment, the edge of the precipice. She could tell the truth, or she could tell another lie, or she could tell the truth that looked like a lie, the particular skill she'd perfected over 52 years. It's complicated, she whispered. I'm 42 years old. I can handle complicated. Could she, though? Could anyone handle the weight of what Maggie had carried? The unauthorized surgery, the injury that resulted, the silence that Captain Brennan had demanded, the marriage built on a foundation of lies, the daughter who'd paid the price for all of it. Jennifer, no. Jennifer's voice was hard now. You don't get to Jennifer me. You lost that right. You want me to treat you? Fine. You want me to remove 50-year-old shrapnel from your foot? I'll do it. But if you want anything more than that, if you want me to understand, to forgive, to be anything other than your doctor, then you need to tell me the truth. Maggie reached into her purse with trembling hands and pulled out an envelope. Old, yellowed, sealed. The paper was soft with age. This was in Thomas's things. After he died. She held it out. I haven't opened it. Jennifer stared at the envelope like it might bite her. What is it? A letter. To me. From your father. He wrote it a month before he died. Why haven't you opened it? Because I'm a coward. Jennifer took the envelope with trembling hands, turning it over to read the inscription in her father's familiar handwriting. To Maggie, open when you're ready. The date beneath it made her breath catch, March 2021. 1 month before the heart attack that had taken him. Should we? Jennifer's voice was barely a whisper. Should we open this? I don't know. Maggie looked at the envelope like it contained something more dangerous than shrapnel. Maybe it's better not to know. Or maybe it has answers. Jennifer sat back down on the stool, the medical procedure forgotten. The shrapnel sat in its basin between them, a small piece of metal that had somehow become the key to unlocking 50 years of silence. The paper was thin with age. Jennifer broke the seal carefully, as if the letter itself might disintegrate. Inside were 3 handwritten pages, covered front and back in Thomas's careful script. Her father had been meticulous, even in his final words. Do you want me to read it? Jennifer asked. Maggie nodded, unable to speak. Jennifer unfolded the pages and began reading aloud, her voice shaking. My dearest Maggie, if you're reading this, I'm gone. And knowing you, you probably waited years before opening this. You always were good at punishing yourself. A small, bitter laugh escaped Maggie's throat. Jennifer continued, "I need to tell you something I should have said in 1972, but I was too much of a coward." She paused, glancing at her mother, then pressed on. "I wasn't unconscious that night in Chulai. I was awake, completely awake." The words hit the room like a physical force. Maggie made a sound, not quite a gasp, not quite a sob. "What does that mean?" Jennifer asked, but Maggie couldn't answer. Her face had gone white, her hands gripping the edge of the examination table. Jennifer kept reading, her voice growing stronger with confusion and determination. "I felt the forceps. I felt you cutting. I heard you crying while you worked. I heard you whisper, 'Please don't die. Please. I can't let another one die.' I didn't know what you meant then. I think I do now. Your brother, maybe? The one you never talked about?" Jennifer stopped. "You had a brother?" "David." The name came out broken. "He was 12. I was 16. He drowned while I was supposed to be watching him." Maggie's eyes were closed, tears streaming down her face. "I failed him. I couldn't fail Thomas, too." The pieces were starting to come together, but Jennifer didn't understand them yet. She returned to the letter. "I heard the explosion, felt you fall, heard you scream. I tried to move, to help you, but I couldn't. The pain." Jennifer's voice faltered. "I saw the blood on your boot. I knew you were hurt. I knew. And I said nothing." Jennifer's hands were shaking so badly now that the pages rustled. "Why didn't I say anything?" "Because you saved my life, and I thought if I stayed quiet you could move on. I thought the silence would protect you. I was wrong. The silence poisoned us both." Maggie was sobbing now, her whole body shaking. Jennifer wanted to reach out, wanted to comfort her, but she was frozen, trapped between the doctor she was supposed to be and the daughter she'd never stopped being. The letter continued. "Every time you looked at me, you saw your failure, the boy you almost didn't save. But I looked at you and saw my savior, the woman who risked everything, including herself. We were looking at the same event from opposite sides, and we never talked about it." "What event?" Jennifer demanded, setting the letter down. "What happened in Chulai? What did you do?" But Maggie couldn't speak. She was lost in memory, drowning in it. Jennifer picked up the letter again, her voice harder now. "Jenny doesn't know any of this. I told her you left because you were sick, because you couldn't handle being a mother. I'm sorry. That was cruel. The truth is, you left because you loved us too much to let us see you break completely." The words struck Jennifer like a blow. All these years, she'd believed her mother had abandoned her because she wasn't enough, because she was somehow deficient, unlovable, and her father had known the truth and said nothing. Dad knew. Her voice was barely audible. "He knew why you really left, and he let me believe—" She couldn't finish the sentence. The letter had more. "I'm asking you to do something. Get that shrapnel removed. I know it's still there. I've known for 50 years. Every time you limped, every time you grimaced putting on shoes, I knew why. I said nothing because you didn't want me to know. But Maggie, carrying that metal in your body is like carrying our whole failed marriage inside you. Let it go. Let us go." Jennifer looked at the shrapnel in the basin, understanding dawning. Her mother had kept it. For 52 years she'd carried a piece of Vietnam inside her, and Thomas had known. had watched her suffer and said nothing because that's what they'd agreed to. A marriage built on silence. "What happened that night?" Jennifer asked again, her voice breaking. "What did you do that required so much silence?" Maggie finally opened her eyes. They were red, devastated, but there was something else there too. Relief, maybe. Or resignation. "I performed surgery on your father. Unauthorized. I wasn't a doctor, just a nurse. But they'd triaged him as low priority. He was dying, and they were letting him die because there were others who were worse." The words came out in a rush now, 50 years of secrets pouring out like the old blood from her foot. "I took him to the OR in the middle of the night. I removed the shrapnel from his back. I had no authority, no real training. I could have killed him. But I didn't. I saved him." Jennifer's mind raced, trying to process what she was hearing. "And when I was cleaning up, there was a rocket attack. The building shook. I fell. The forceps I'd been using, they had another piece of shrapnel on them from the tray. It went into my foot." Maggie gestured to the wound Jennifer had just opened. "That shrapnel, that piece, it's been there ever since." "Why didn't you report it? Get it treated?" "Because if I did, they'd ask questions. They'd find out what I'd done. Captain Brennan, the surgeon who'd refused to operate on Thomas, he figured it out anyway. He covered for me, but only if I agreed to never speak about it. To anyone. Ever." The room felt too small, the air too thin. Jennifer stood, paced to the window, her back to her mother. Outside, Portland went about its ordinary day. Cars passing, people walking, the world continuing as if it hadn't just tilted on its axis. "So you married him," Jennifer said slowly. "You married the man you saved. And you could never tell him you'd saved him." "He knew anyway, according to that letter." Maggie's voice was hollow. "We both knew and both pretended not to know for 50 years. And me?" Jennifer turned around. "Where do I fit in this? You were supposed to be the fresh start, the proof that we could move past it, be normal." Maggie's laugh was bitter. "But I couldn't do it. Every time I looked at your father, I saw that boy on the operating table. Every time I looked at you, I saw everything I'd destroyed by saving him. That doesn't make sense. It doesn't have to make sense." Maggie's voice rose. "I was 20 years old, traumatized, carrying a secret that could have landed me in military prison. I married a man I'd literally cut open. I had a daughter while drowning in guilt I couldn't name. And when the weight of all those lies became too much, I did the only thing I could think of. I left." The truth hung between them, ugly and honest, and more complicated than Jennifer had imagined. "The letter," Maggie said quietly. "Is there more?" Jennifer picked it up with numb fingers and read the final lines. "Jenny became a doctor because of you. She wanted to save people like you saved me. So let her. Let her take out that shrapnel. Let her heal the wound I couldn't. You saved me once. Let your daughter save you now." The silence after Jennifer finished reading was absolute. Even the fluorescent lights seemed to hold their breath. The letter lay between them like a bridge that neither woman knew how to cross. Jennifer set it down carefully, as if it might shatter. Her hands were shaking. Her whole body was shaking. "I became a doctor because of you," she repeated, her voice hollow. "He says I became a doctor because of you." "Jennifer." "No." The word came out sharp, cutting. "You don't get to explain this away. You don't get to make this okay." Maggie's face crumpled, but Jennifer couldn't stop. 29 years of pain was rising up, demanding to be heard. "Do you know what it was like?" Jennifer's voice cracked. "Being 13 and watching your mother pack a suitcase?" standing on the porch, screaming for you to come back, and you just kept driving? I'm sorry. I had to figure out everything alone. Periods, boys, heartbreak, college applications, everything. Jennifer was pacing now, unable to stand still. Dad tried. God, he tried so hard. But there are things a father can't teach a daughter, things only a mother can. Maggie's sobs were silent, her shoulders shaking. But Jennifer couldn't let herself care. Not yet. Not when she was finally saying the things she'd held inside for decades. I used to make up stories about why you left. Maybe you were sick. Maybe you were protecting us from something. Maybe you'd been kidnapped and the woman who left wasn't really you. She laughed bitterly. Anything was better than believing you just didn't want me. That's not true. Then what is true? Jennifer spun around. Because, according to that letter, Dad knew. He knew why you really left. And he let me believe you abandoned us because we weren't enough. Because I wasn't enough. You were perfect, Maggie whispered. Then why wasn't I worth staying for? The question hung in the air, raw and devastating. Maggie had no answer that would satisfy it. No words that could undo 29 years of damage. I thought, Maggie began, her voice breaking, I thought you'd be better off without me, without seeing what I'd become. Better off? Jennifer's voice rose. I spent my entire teenage years thinking my mother looked at me and found me lacking. Do you know what that does to a person? I know. No, you don't. Jennifer slammed her hand on the counter, making instruments rattle. You weren't there. You chose not to be there. The anger felt good, cleansing, like lancing an abscess that had festered for years, but underneath it was something worse. Underneath was the grief of a 13-year-old girl who'd lost her mother and never understood why. Jennifer's voice dropped to a whisper. I still loved you. After everything. I still loved you, and I hated myself for it. Maggie looked up, tears streaming down her face. You had every right to hate me. That would have been easier. That would have been... Jennifer sank onto the stool, suddenly exhausted. Hate is clean. Hate has boundaries. But loving someone who left you, that's torture. Because part of you keeps hoping they'll come back. Keeps thinking maybe someday they'll explain. They'll make it make sense. She gestured at the letter, at the shrapnel, at the whole impossible situation. And now you're here, with metal in your foot and secrets in your past, and somehow that's supposed to explain everything? It doesn't explain everything, Maggie said quietly. It doesn't explain why I wasn't strong enough to stay, why I let my trauma become your trauma. Jennifer wiped her eyes, trying to regain some composure. She was a doctor. She was supposed to be professional. But how could you be professional when your patient was your mother and your entire childhood was being rewritten in front of you? Your foot is bleeding again, she said, noticing the blood seeping through the gauze. Maggie looked down as if surprised to remember why they were here in the first place. Is that bad? The capsule breach is worse than I thought. Jennifer examined it, falling back into clinical mode because it was safer than feeling. We need to get you to a hospital. This needs proper surgical debridement. There could be retained infection. No, this isn't negotiable. I'm not going to a hospital. Why not? Jennifer looked up, frustrated. You finally got the shrapnel out. Don't let infection. Because I'm tired, Jennifer. Maggie's voice was flat, resigned. I'm 71 years old, and I'm tired. Something in her tone made Jennifer's stomach drop. What does that mean? It means maybe this is how it's supposed to end. Don't. Jennifer's voice was sharp. Don't talk like that. Why not? Maggie met her eyes. Thomas is gone. You hate me. What do I have left? Me? The word burst out before Jennifer could stop it. You have me. Do I? The question was so quiet, so vulnerable, that Jennifer felt something crack inside her chest. This woman, this broken, complicated, impossible woman, was her mother, had always been her mother. Even in absence, even in silence, that hadn't changed. You survived a war, Jennifer said, her voice shaking. You survived 52 years with metal in your foot. You survived losing Dad. I didn't survive. I existed. Then start surviving now? It's too late. It's not. Jennifer grabbed her mother's hands, the first time she'd willingly touched her in 29 years. It's not too late, not if you fight. Maggie looked at their joined hands, tears falling onto them. I don't know how to fight anymore. Then let me fight for you. Jennifer squeezed tighter. That letter. Dad said to let me save you. So let me. Please. Why would you want to? Because you're my mother. The words came out as a sob. Because I spent half my life hating you and the other half missing you, and I'm so tired of both. Because maybe if I can save you, I can save us. Maggie was crying openly now. There might not be an us to save. There might not be. But I want to try. If you'll let me. Jennifer's voice dropped to a whisper. Please, let me try. The silence stretched between them, heavy with possibility and pain. Outside, the October sun was beginning to set, casting long shadows across the examination room. The shrapnel sat in its basin, no longer inside Maggie's body, but somehow still between them, a physical reminder of all the weight they'd both been carrying. Finally, Maggie nodded. Okay. Okay. If I go to the hospital... Maggie's voice was barely audible. Will you stay? Not as my doctor, as... She couldn't finish, but Jennifer understood. As your daughter? A small nod. Jennifer took a shaky breath. The word felt foreign on her tongue, unused for so long, but she said it anyway. I'll try. That's all I can ask. It wasn't forgiveness. It wasn't even close to healing. But it was a beginning, and sometimes that was enough. The emergency room at Portland General Hospital moved with controlled chaos around them. Jennifer had driven, Maggie silent in the passenger seat, Thomas's letter folded carefully in her purse alongside his cardigan. The radio had played What a Wonderful World during the drive, and neither woman had commented on the coincidence, though both had noticed. Now Maggie sat on a hospital bed while an ER physician Jennifer didn't know examined the wound, asking questions Jennifer had already answered. IV antibiotics dripped into Maggie's arm. Blood cultures had been drawn. A surgical consult was pending for tomorrow morning. 52 years, the ER doctor kept saying, shaking his head as he examined the shrapnel fragment Jennifer had brought in a specimen container. I've never seen anything like it. Jennifer stood against the wall, arms crossed, watching. She'd insisted on staying. citing her role as both Maggie's physician and her daughter. The nurse had looked confused. Which one? And Jennifer had answered, both, though she wasn't sure either was entirely true anymore. The ER cleared eventually, leaving them alone in the curtained bay. Machines beeped softly. The smell of antiseptic was overwhelming, and Jennifer watched Maggie's face carefully, looking for signs of distress. Hospitals could be triggering for people with her mother's history. "You okay?" Jennifer asked. "Reminds me of Chu Lai," Maggie said quietly. "Different equipment, same smell." Jennifer pulled up a chair, sitting beside the bed. The formal distance they'd maintained in her clinic felt impossible to sustain here. "Tell me about that night. The real story." Maggie closed her eyes, and when she spoke, her voice was distant, lost in memory. "November 3rd, 1972. Night shift. I was doing rounds when they brought him in. Dad. Private Thomas Calloway, 21 years old, shrapnel in his lower back, close to the spine. Conscious, in pain, asking if he was dying." Maggie's hands twisted the hospital blanket. "I told him no. I promised him he wasn't dying." She opened her eyes, focusing on Jennifer. "But Captain Brennan, the surgeon, he looked at the wound and said low priority. There were others worse off, men who wouldn't last the night. Thomas could wait." "How long did he wait?" 7 hours. His fever was climbing, wound showing signs of infection. He was delirious, calling for his mother. Maggie's voice broke. "He was the same age as my brother when David died. Same dark hair, same way of looking at you like he was trying to memorize your face in case he never saw it again." Jennifer felt a chill run down her spine. She'd seen photos of her father at that age, had never realized how young he'd really been. "So, I took him to the OR, 3 in the morning, when everyone was dealing with new casualties. I wasn't a surgeon, barely a trained nurse. But I'd watched enough procedures. I knew where the instruments were, how to irrigate, how to clamp bleeders." "You operated on him." "I removed the shrapnel from his back. It took 40 minutes. My hands were shaking the entire time, but I did it. He lived." Pride and shame warred in Maggie's voice. "And then I was cleaning up, and the rockets hit." The memory was so vivid in Maggie's eyes that Jennifer could almost see it. The young woman in the operating room, the sudden explosion, the chaos. The whole building shook. Things fell from the shelves. Instruments, supplies, pieces of metal from previous surgeries. I lost my balance, fell forward. I had the forceps in my hand, and there was shrapnel on the tray, the piece I'd just removed from Thomas, or maybe a different piece, I don't know. The forceps drove it into my foot." She looked down at her bandaged foot. "I bit down on a towel so I wouldn't scream. I couldn't let anyone know what I'd done. So I wrapped my foot, cleaned Thomas's wound, got him back to recovery. No one noticed in the chaos." "What about Brennan?" The letter said he knew. "He figured it out 3 days later. Thomas was healing too well, too fast. The surgical notes didn't match his improvement. Brennan called me in, asked questions." Maggie's smile was bitter. "He could have court-martialed me. Instead, he made a deal." Jennifer leaned forward. "What kind of deal?" "He'd take credit for the surgery, cover for me. But I had to leave Vietnam immediately, medical discharge for my foot injury, and I could never speak about it to anyone, ever." "Why would he protect you?" "Because he knew he'd made the wrong call. Thomas would have died if I hadn't acted, but if it came out that a 19-year-old nurse had performed unauthorized surgery, it would undermine everything they were trying to do there. Better to bury it." "So you came home?" 3 weeks later. December 1972. Thomas was still in recovery. We exchanged addresses, promised to write. Maggie's voice softened. He came home in April 1974. We started dating, got married a year later. And you never told him. How could I? Brennan made me promise. And besides, how do you build a marriage on "I saved your life by committing a crime"? Maggie looked at Jennifer, desperate for understanding. I thought if I just buried it deep enough, we could be normal. We could be happy. But you weren't. No. Every time I looked at him, I saw that boy on the operating table. Every time he touched me, I felt the forceps in my hand and the shrapnel in my foot. It hurt, especially in the winter, and every time it did, I thought, good. This is what you deserve for lying. Jennifer's chest felt tight. She'd built her entire understanding of her parents' marriage on the story her father had told. That Maggie had left because she couldn't cope, because she was damaged, because they weren't enough. But the truth was so much more complicated. And when I was born? You were supposed to fix everything. Maggie's laugh was hollow. Isn't that what people think? That a baby will heal all wounds, bridge all gaps? But you just made it worse. The words stung, even though Jennifer had suspected them. Not because of anything you did, Maggie rushed to add. You were perfect. But looking at you, this innocent child, I kept thinking about all the lies I was living, how I was raising you in a house built on secrets, how one day you'd be old enough to ask questions I couldn't answer. So you left. So I left. Maggie's face was wet with tears. I convinced myself you'd be better off with Thomas, with a father who could give you stability, normalcy, a father who wasn't drowning in guilt every time he looked at you. Jennifer sat back, trying to process everything. Her entire childhood, recontextualized. Her father's silences, her mother's absence, all of it stemming from one night in 1972 when a scared young woman had decided to save a dying soldier. The letter, Jennifer said slowly. Dad wrote that he knew, that he was awake that night. I know. Did you believe him? Maggie was quiet for a long moment. I don't know. Part of me wants to. Part of me thinks maybe he convinced himself of it later, trying to make sense of why our marriage failed. Does it matter? Maybe not. He's gone either way. Maggie looked at the IV in her arm, at the hospital room around them. But if he really did know, if he spent 50 years watching me suffer and said nothing, because he thought silence would protect me. She couldn't finish. Then you both made the same mistake, Jennifer said quietly. You both chose silence over truth, and it destroyed you. 6 months later, the April sun filtered through the windows of Jennifer's Northwest Portland condo, casting warm light across the kitchen where two women worked side by side. The cherry trees outside were in full bloom, their petals drifting past the window like pink snow. Maggie stood at the counter chopping vegetables for dinner. Her left foot, visible in the sandals she now wore without shame, bore a long scar across the top, clean, healed, a story written in flesh. She no longer limped, or rather, she limped differently. Not from pain or punishment, but simply from the reality of a 71-year-old body that had lived a full, complicated life. "Can you hand me the—" Jennifer began. Maggie passed her the olive oil before she finished. Jennifer smiled. "You remembered." "Some things you don't forget." The surgery had been successful. 5 days in the hospital, IV antibiotics clearing the infection that had lurked in the tissue for decades. Jennifer had visited every day, bringing coffee and conversation that grew less awkward with each visit. By the 3rd day, they'd progressed from weather to memories. By the 5th, they'd laughed together for the first time in 29 years. Maggie had moved into Jennifer's guest room temporarily in October. It was now April, and neither had mentioned her leaving. They'd started therapy in November, both together and separately. Maggie had been diagnosed with complex PTSD, survivor's guilt, depression, that had gone untreated for half a century. Jennifer had her own diagnoses: abandonment trauma, complicated grief, the particular pain of loving someone who'd hurt you deeply. The therapist had warned them healing wasn't linear. Some days would be good. Some days Maggie would wake up and couldn't look at Jennifer without crying. Some days Jennifer would hear her mother's footsteps and feel 13 years old again, standing on that porch, watching her drive away. But there were more good days now than bad. Every Sunday they visited Thomas's grave together. Portland Memorial Cemetery, Section C, under an oak tree that was just beginning to leaf out. Maggie brought carnations, his favorite. Jennifer brought updates about her work, her life, the small details he'd missed. Today they'd placed the letter with him. Jennifer had suggested it weeks ago, and Maggie had finally agreed. "I think he'd want this with him," Jennifer had said, tucking the envelope into the earth beside his headstone. They hadn't cried this time. That felt like progress. "Maggie?" Jennifer said now, pulling her from memory. She still couldn't say Mom. Maybe she never would. But Maggie was said with warmth now, with affection, and that was enough. "Yes? Do you ever regret it? Saving him?" Maggie set down her knife, considering the question carefully. "Regret saving him? No. Regret not talking? Every single day." She turned to face her daughter. "But I'm trying to do better. With you." "I know." Jennifer smiled. "You're doing good. You are too." They finished preparing dinner in comfortable silence, the kind that only comes when two people have finally stopped running from each other. The radio played quietly in the background, and when "What a Wonderful World" came on, because of course it did, they both smiled at the coincidence that no longer felt coincidental. "I've been thinking," Jennifer said as they sat down to eat, "about getting your nursing certification framed for the wall." Maggie looked surprised. "Why?" "Because you were brave. What you did, it was unauthorized, maybe even reckless, but it was brave. And you've spent 50 years punishing yourself for it. I think it's time to remember that you saved a life that night. I broke the rules. You saved my father. You gave me 18 more years with him than I would have had otherwise." Jennifer reached across the table, taking Maggie's hand. "That matters." Maggie's eyes filled with tears, but she was smiling. "Okay. Okay? Let's frame it." After dinner, they sat on the couch with coffee, watching the cherry blossoms fall outside. On the mantel, the shrapnel fragment sat in its specimen jar next to Thomas's photograph and their wedding picture. Next to those was a new photo. Maggie and Jennifer, taken last month, both smiling genuinely for the first time in decades. "You know what Thomas told me once?" Maggie said quietly. "What?" He said, "The best soldiers aren't the ones who never fall. They're the ones who get back up." Jennifer squeezed her mother's hand. "We fell pretty hard." "Yeah, but we got back up." Outside, the cherry blossoms continued to fall, and inside, two women who had been strangers were slowly, carefully, becoming family again. Some wounds take 52 years to heal, but when they finally do, they teach us life's most important lesson. It's never too late to come home. This story reminds us that silence, though sometimes chosen out of love, can cost us more than any truth ever could. Margaret carried a piece of war inside her body for over 5 decades, but the real shrapnel was the guilt, the secrets, and the words left unspoken. She thought leaving would protect her daughter, but what Jennifer needed most was simply the truth. How many of us carry our own silent burdens, convinced that speaking them aloud would hurt the people we love? How often do we mistake silence for strength, when really it's just fear wearing a different mask? The beautiful truth is that healing can begin at any moment we choose. When Jennifer held her mother's hand across that hospital table, when Maggie finally let someone see her scars, that's when real freedom began. Not in forgetting the past, but in finally telling its truth. What secrets have you been carrying that might be lighter if shared? Have you ever discovered that the story you believed about someone wasn't the whole truth? Drop your thoughts below. Your story might be exactly what someone else needs to hear today.